Yeah, she knows
that.
Yep.
So,
Okay, ladies and gentlemen, we are live. Welcome everybody to Senate Economic Development, Housing and General Affairs. It is Tuesday, February 20th. I don't know how it got to be February 20th already. Anyway, here we are, and our chair is not feeling a little under the weather. She's with us by Zoom. So Keisha, it's great to have you. And I'm sorry you're feeling so yucky. But today we're going to look at pieces of housing that are real priorities for us in many ways, and ones that we want to further discuss, even though they weren't included in our housing bill as 311. It doesn't mean we won't take action on them this session. So to begin this conversation today, we're going to start with Chris Donnelly, who's, as everybody knows, the Director of Community Relations at the Champlain Housing Trust. And we're going to address some of the housing needs and concerns that are still out there. Is that sort of that's my understanding. So we sort of housing needs for the next 5 to 10 years. So Chris, it is yours.
Great, thank you. It's great to be here. Chris Donnelly with Champlain Housing Trust for the record. I'll just give you a little additional preamble before I share the screen and give you handouts. Last December, a number of housing and homelessness advocates and providers met with a number of different chairs in both bodies to discuss our legislative priorities for the upcoming year. And in that meeting, we had a little pushback. We were asking for appropriations, and we were asked, what is this going to, you ask for money every year, what is it going to buy us? What is it going to get us? Are people going to be better off? When we move people out of motels? What's your long-term vision?
Right.
What's your vision? Every year you come to us. And frankly, it's something that I know a lot of lawmakers have asked the state to do. It's kind of longer-term planning. So I raised my hand and offered to try to do some modeling for what it would look like if resources were available for the nonprofit sector and service agencies. I want to stress first that this is not a housing needs assessment. It's not saying we need 5,000 homes. Here's how we're going to build them. What it really is saying this is what the capacity is, and if we fund it as we've been funding it the last several years, this is what you'll get. And with a finer point on, can we move people away from motels and hotels into a more sensible, saner, hopefully cheaper, better outcome type of system.
May I just push back a tiny bit, which is we have funded housing at a rate that we have never seen in the state in the last 4 years.
Yes,
over $500 million.
Yep.
So are you saying to us, that if we continue to fund housing at that rate, we won't make it, or are you talking about the rate before? Which rate are you talking about? Because we obviously can't sustain the rate of 500 million a year.
Right.
Or over 4 years.
So I'm just saying this is just a model, and the numbers there's a series of spreadsheets, and the numbers can change based on policy decisions that you make here. I'm trying to take my advocate's hat off and just give you a tool that you can use. So what the model is what we've been doing the last few years. What does that look like in 3, 4, 5, 10 years even? And what does that do to people, right now, currently in motels and so forth? I'll run you through that. It would be great if there's a lot of numbers and we could go down a lot of rabbit holes along the way. It'd be great if I can kind of run through it. And if you're confused, and if you stop me, so I want you to understand the exercise I've done. But then we can get into some more of the details after I kind of walk you through this, if that's okay with you.
May I ask one further question, which is 5 to 10 years. I'm just curious if you're going to also track people and how they succeed over the 5 to 10 years. Are you going to do any kind of longitudinal study of the people who are participating in some of these programs over time, so that you can see the impact on individuals' lives over 5 to 10.
We could do that. I mean, the modeling I have is just.
Yeah, the modeling takes into account.
It's just a series of spreadsheets. And
Okay,
it tracks, housing built, shelters built, and how much it costs. And it doesn't, and services added to it, to hopefully people will succeed. It's not a social scientist exercise.
okay, so it's still not tracking how we measure success
Yeah.
with individuals.
I'm just a guy with a couple spreadsheets.
Yeah, well, we'll see. You're much more.
Yeah. So let me dive into this and, I'll share the screen and I actually have a handout here because it may be harder, easier for you to see on paper.
I'm glad to have the screen up.
Okay, and may I have one for Keisha when she returns inspection?
Here, I've got one for Keisha. May I have one?
Yeah, I was gonna,
Oh,
yeah.
I put it in Brandon's place. Thank you.
All right, so, that's up there, great. So, let me just make this a little bit bigger. So this is what I did, I talked to a lot of people that are smarter than me. And I created 18 different variables ranging from, and I'll show you, those are at the end. They're ranging from what it costs to build housing to, what inflation rates are, what costs to add services in, a number of different variables that I've put into just a modeling to say, this is what happens if we put resources in. Again, it's not a housing needs assessment, it's just a model, just a tool for you to use. And it's based primarily on the existing capacity of the nonprofit sector, and what you've been funding in the last several years.
Right, but I guess.
Yeah.
I guess that's the challenge is.
Yep.
We have been funding at an extraordinary rate over the last 4
Yeah.
years. So that is in and of itself unsustainable for us.
But we've been using federal money to
Yes.
supply it.
Which was an appropriate thing to do, that was.
Oh, right,
only
yes,
right
and-
thing
and
to do.
during- and I didn't say this in the-
Yes.
Yeah, I didn't say this at the outset, thank you so much for that. Yes, I think it's taken for granted, but I shouldn't take it for granted. But again,
But I guess that's the question is it based on the spending of the last 4 years or based on the spending sort of averaged out before that?
so this is just based on the last few years, and what we see is like, we know we need to do more. It's a model, you can play around with the numbers. It's not lost on me that there are a few people from the finance committee here that certainly will have a big say in terms of if there are resources available. So I'm trying to just give you a tool and what's possible.
Right.
The projection says about 7,500 homes, about 300 shelter beds. And what I did was I front loaded some of the spending in early years to be more appropriate for people moving out of the motels, so we could stop sinking money into those as much and better systems in place. Leverage a lot of money over the 10 years, 1.5 billion over 10 years, both private and federal funds. And I think it's as much as I really appreciate the work that you've done last year with the Home Act and this year with the Be Home Act. And I wish you had done it 20 years ago, because I might not be here if we had done all that years ago. I think it's important to also think about resources too, because the lowest income people it's gonna take a while for the market to serve the lowest income people. So.
Thank you. And may I just ask a question? So you're dealing with, in this case, after the fact of the trauma, after the fact of poverty, after the fact of the domestic violence situation. You're dealing with them as they choose, as they become homeless or are in need, particularly with the shelters of time. How, one of the things that concerns me is that how are we narrating this with prevention?
Yep.
Because to
That's
me,
some of
we
the
are
things that-
spending money on a Band-Aid here
I agree.
as opposed to spending even more significant money
You'll,
impacting lives.
yeah, you'll see
Okay.
some of this
Oh, good.
coming up.
Right.
Yep, sorry to interrupt you, but
No, that's good. I was interrupting you, so.
so this next page, this is just the 40,000 foot level, this next page. The first initial things that I was mentioning, versus we invest in some permanent supportive housing. This is housing with services right attached. And this is to be done in the first 2 or 3 years of what I've done. We have has 200 beds, shelters. And then there's something that we don't really have much of right now, and that's somewhere between a motel bed and a hospital bed for inpatient care. And so there needs to be some kind of specialized services.
Sort of like advanced assisted living.
It's more of a shelter with, or some other facility with services attached to it. And so this is something that we really need AHS to help figure out how to address these special needs, because we have people in motels. We had someone yesterday in one of our motels walking down the middle of Shelburne Road. And they shouldn't, and because they were in crisis. And it shouldn't be a motel. They should have some other type of thing. And they don't need to be committed to a hospital, but we need some other type of thing. So that's what this talk is really trying to get at some of the immediate needs in the more the homelessness. At the same time, I'm sorry.
No, so we've got mental health needs.
Yes.
You're walking down the middle of Shelburne Road, you've got something going on. But we also have physical needs. We have, in the motels now, we have disabled people. And last year, we upped the payments to assisted living facilities, which in the past were much less than you paid for an economizer. And you got 3 meals a day. And so we thought those facilities might take more of our disabled or people who needed medical care. Has that happened?
I don't know. I think that's a good question for AHS. I don't probably think it's happening at the scale or the speed. I do know that in the Act 60 or Act 81 reporting that DCF does, they're supposed to give you a census of how many rooms are vacant in some of these facilities. So that's where I would look to see if it's actually working or not.
Next
So-
time, they send us the joint fiscal, I think. So
Yeah.
I will check.
So-
And then would that be the kind of the AHS medical respite, would that be the kind of facility that we need now for folks who are stuck in hospitals? Where hospitals
It could be, yes.
have finished their treatment, but the person has no place to go
Yes,
to
I think
recover?
it's a
be
range.
either
It's a
way.
range.
Because there's a lot
range
of-
stuff. Yeah, there's a range of stuff. So is 100 the right number? I don't know. This is just, I needed to start with some kind of
Okay.
modeling. And but we really need a partner, AHS, to help work this. So this is an immediate need that I know people feel a lot of budgetary pressure over, and it's the human pressure over this. But at the same time, we do need to invest in the real solutions, which I think are creating more affordable housing and a range of housing all the way to homeownership. The whole market needs some support. So you see in the bottom of this page, these are over the 10 years, those are the number of homes that my model created. So see at the bottom, it says 7,300 plus 200 supportive housing. That's about 7,500 homes over 10 years. If we again fund the capacity.
Figuring to the people that might be forced out of their homes by 20% property tax increase.
It does not. mean,
And
yeah.
that's a big concern.
Yeah. So I have this, when I did my modeling, I can't take into consideration everything's happening externally. Like, I don't know what happens when we have a new president in the fall.
I don't know.
So it's like, there's all sorts of things that I
Hoping
can't
steady
control.
state.
Yeah. So, I hate to even say that out loud, but, so you'll see as I go through this next page, what I'll do is I'll break these numbers out, year by year.
Okay.
And then just another question, because it's on who you're talking about. For the folks getting out of incarceration, which is a fair amount of people, there used to be more support for them.
Right.
And now there's not, because of the redeployment basically of parole staff and lack of parole staff. So some of the the private renters do not rent to them anymore because they don't have those support services. So do you
Yeah,
have
so I don't have
idea
that
of that?
specifically in here, but what I will say is that these are great things to have included in a housing needs assessment
Yeah.
that BHFA is doing right now, and that should be done
Yep.
in May. But these types of things I would hope would kind of live someplace. Again, this is just like, this is what we can produce, and it doesn't get into that nitty gritty
Okay.
details.
So you don't have a number of correction alumni that need housing, because
I don't have
But
that.
no, I
That's-
could,
But
Yes,
you
I mean,
can
we would have to talk to GCF about
get
that.
the number
Not
of
GCF.
people that are
DOC.
being detained presently.
Oh, yeah.
And it's been a problem for years. They can't find suitable housing, and so they're still in prison, which is not fair to them, and it's costing us a lot of money.
I recall, this was back before the housing bond, I've been, I've been running this for a little while. I know the number was around 120.
a year.
$60,000 a year or something, and so
Oh,
it's
no,
just,
it's huge.
so.
But more importantly, we want people who have finished their time to be successful on the outside. And we have reduced the number of ways to have them re-enter in some transitional housing. We have a few pets at Dismas House in different towns, but I mean, nowhere near what we used to have and nowhere near now.
Right, and so
Right.
you're voicing this all sorts of problems with our housing system right now, and this just one piece, and it's lots, it's not a system, it's not holding together. And so I'm trying to help people think about building a system and by doing this model. So on the next page, what I did was I broke down those 10-year totals into each year. And so you can see what the different types of housing that you generate, and I'm walking you through this because the next page, we're gonna get a little bit more.
But wait a minute, let's get to this one
Yeah.
first.
So, these are the total amount of housing, the gray out fiscal year 24 is gray, there because you're in it right now, you've already paid for those. My modeling takes, it says, 12 to 18 months before, from the time you spend the money or allocate the money, to the time housing gets built, there's some time. So that's why there's a 11th year in this, which is fiscal year 35. So the 10th year of spending in fiscal year 34 actually creates the housing in fiscal year 35.
Can you say again?
Yep.
About what the assumptions on when housing comes online
Between
versus the,
12 to 18 months
Okay.
after
of all
After
of
we
these
appropriate.
programs?
you appropriate.
Okay,
Yeah. So that it's not, this is a,
well, you
Um,
have to have some
yeah,
sort
this
of
is,
parameters,
it's not, I wouldn't call it blunt, but I wouldn't call it surgical either.
but it's good that you're doing it, I appreciate it.
So you see there in this top here, total per year, and then the cumulative total. And on the fiscal year 34, there's that 7,500 number again. Then in the bottom, I have these front loaded, as I was talking before, the ones in orange. And these are the ones that are, this is the housing being created directly to help people move out of the motels and address homelessness a little easier. So just separated those out by a color, so you can see them kind of flow through these charts.
Barely see them.
Yeah, so,
Uh,
well,
So, the impact of our federal money on our housing units that we're able to build, we see in the 900 units and the 837, that's all. The 500 million that we've appropriated, that's beginning to come to fruition there.
Yes.
Those numbers.
Yeah. and at the fiscal year, I had, Magali knows this, I had these problems with this spreadsheet. The fiscal year 24 number is wrong in this, and then the fiscal on the screen.
It's gotta be
And then,
higher.
I just, something happened with the formulas. Fiscal year 25 through 34 are correct. I will send you a corrected file once I find out where.
Magali's
are.
kindly corrected some of this.
Yes, I wrote in, I found the fiscal year 35 problem, but I just had the worst morning with things.
Sorry, so
It's good until it is,
Between 25 and 34, perfect. The total units created and 24 and 35, I just need to correct for you.
I would think 318 was way low,
Yeah,
given the amount of money.
you can
we
even look
thrown.
at the numbers, and the top number there is 355, so I apologize for that.
Yeah.
a number, probably many years ago, because I think I was a judiciary, maybe health and welfare. They were opening a housing unit that had staff there all the time. And it was down there, I think, near Brattleboro. And did that actually come to fruition, and is it working? Because some people that are homeless just need a home
Yep.
and they're fine.
Yep.
Other people need a whole lot of mental health care, need a whole lot of substance abuse. Because if they don't get out of it, they're not going to be able to stay in any housing situation.
That's what this permanent supportive housing really is. It's like services right there on site. We do a couple of these sites. There's also other models that I didn't put in here, is we need more recovery beds.
Yeah.
You know, there's a whole range of things. that-
Recovery, both from corrections and from mental health and other.
But they're different. and
Yeah,
so they're all- they're
yeah, so
different.
this, so this is why the needs assessment is really gonna help you. What I will say, and I've said this a few times to people, is we're gonna get a needs assessment in May. I don't wanna be part of a stakeholder group that then does a dog and pony show around the state to collect community input all over the summer and the fall, and to come back to you next January to tell you that you need more housing.
We already know that.
We know that, and I don't think we're gonna be in the danger of overbuilding in a year.
That's
so-
true.
So I just,
You can
as-
safely say that.
as, so I don't mean to be flip about it, but
Yeah.
as we think about that, like
Yeah.
really turning this into a longer range plan and drilling down to exactly what we need and where we need it and how much we need. Let's not take the foot off the gas.
So your number for FY 24 is 923.
Yes, you did the math. Thank you.
No, I totally agree,
Yes,
and
thank you.
it's really good that you're starting the plan,
Yeah.
because we have to plan long
Yeah.
term, and we have
Yeah.
a futures project too.
Yeah.
I mean,
yeah,
this,
I think-
this
yeah.
could be incorporated,
I-
they could help us.
Again, I just wanted to provide another tool for people to use to think about what.
Oh, this is terrific.
So.
Okay.
I just wanna
Okay.
understand
Yeah.
what exactly these are, I mean, VHIP I know, and I think we've actually done more than this, but manufactured housing, that's,
There's a state tax credit that flows through VHFA that funds down payment assistance to allow for a new manufactured home to go into a park. We run part of the program. It's been used. It was doubled about 3 years ago.
so it's a specific
So
program,
Yeah.
right?
I'm sorry.
No, go ahead, please.
Farm worker housing is something that's funded through VHCP. That's a program that we also run. Those would be maybe less apartments, but more beds in a building, substandard housing that is being brought back up to code. We gave loans to farmers to do that.
We're familiar with some mobile homes that are being used for farm worker housing,
Yeah,
the
that's
efficiency
a-
Vermont, is that part of that program?
That's a subset of that program.
Cause those are great.
Right, they're pricey. So this is a
Two
well,
hundred thousand for 5 units.
right,
or
but
five
what we're doing is $30,000 loans to farmers to
Okay.
rehab a
Okay.
4-unit building.
Okay.
So pricey in comparison.
I see what you're saying, okay, and then homeownership,
Homeownership, the VHFA started this program a couple of years ago to help subsidize.
Middle income.
Yeah, it was called the
But you also
missing
do
middle.
home ownership as
Yeah.
affordable housing.
okay,
Yeah,
so I,
and so this is just funding that program, and VHCB also does some support of homeownership too.
They do down payment
Yeah.
assistance, and that is critical. Because when you're paying that almost $2,000 a month in rent, it's pretty hard to save up a 20% deposit. And if you don't, you have to pay for mortgage insurance, which can be $300. It's probably more now a month.
right,
So to get that 20%, right, to get even,
Close to it, right.
yeah, I mean, even an acceptable deposit is
Right.
very, very difficult for people who just, because the present housing is so costly,
right,
they
oh,
can't.
I've been there,
So what
so
what I'm
is
trying to
this
do,
not shared equity?
it's
Okay, I
both
just
shared
wanted-
equity and
Yeah.
it's
So we have,
both, yeah.
this isn't just middle income, this is.
And then would it be also the
Let's find out the cost.
first generation home
The
buyer?
first generation is not in here because this is a capital,
Right,
this is a production.
Okay,
This is a
okay.
production. There are all sorts of great programs that you've supported, including the first gen program, that aren't in here because they're just
they are
other,
producing
not
houses,
producing, and so.
they're enabling people, but they're not.
You know, it would be great if somebody could take this and figure out how this interacts with the budget, and that's gonna blow my mind, to try to to figure that piece out. Again, I've been collecting information and trying to, have a start.
Okay,
So I just want to orient you before, this is the total universe of subsidized, that we would do. I want to orient you before we go to the next page. Look at fiscal year 25 and see the 377 number. That,
Yes.
okay, so when I go.
Sorry, I'm still on this page, we still haven't gone down and looked at the shelters.
Yeah, okay, so the shelters, are
Three
just,
seventy-five, I don't see a 370.
okay,
77.
377,
Oh, yes.
this will be 25.
FY 25.
So I just want to orient you, so think about that number for a second. And then I'm gonna go to the next page. And you look at fiscal year 25. And then the first line, new rental construction. 94 is 25% of 377. This is a chart of how many people are moving out of homelessness when we create this housing. So when we build something new, like that 377 is on the previous page, we set aside 25% of those apartments for people moving out of homelessness. So that number 94 shows up here.
So the 94 is derived from the 377?
25%.
Okay.
So you follow me?
Yeah, I'm following you. What I'm wondering is putting 20% formerly homeless people in a building with non-homeless people, probably lower income. Are we doing that? Is it working? Have we found issues?
What we found is that it's good to have a balance. We want to have a mixed income, and we have had to, as we've increased the number of people coming out of homelessness into our portfolio, and you'll see this a little bit more down lower on this chart, we've had to add additional kind of resident service coordinators. And so
Sure.
that's later in the model, you'll see, that need. That
Yes.
needs, because we want to make sure people succeed and
Right.
that everybody's happy and that,
Somebody
you know,
needs to be a mediator.
yes. People are
And a
people.
coach.
Yes.
A
Yes.
lot of times it's coaching where they just.
Yeah, well, yeah,
Learn.
we had a young guy that lived up second floor apartment on Blanchard Block in Montpelier, that's main block by the fire station. He was a mental health patient, had a social worker. Didn't take out his garbage, never,
Yeah,
started to have trouble with the neighbors because there were rodents and just took a while to
Keep
coach
following that,
him that, no, you need to take it down and this is where you put it. And he's a model tenant
Yeah,
at
and
this
check
point.
in with them every few months. Yeah.
Oh, he checks into the
Yeah,
TV
yeah.
office every day, but
So, I'm conscious of the time too, and that this is another witness, but, so I just wanna, I love that story, but let's keep moving. The VHIP apartments, the earlier iteration of this, they were taking everybody out of homelessness, everyone's reporting entries. That program.
Not the ADUs.
Not the ADUs, correct, but that program is now shifting to have a couple different options for property owners. And 50% is just a target, because there are gonna be some that may not be necessarily dedicated to people moving out of homelessness, and there's some that will. Without the program up and running, I don't have any data to tell you, but I just pegged 50% just because when I talked to DHCD, they said, okay, that's a good start. This number can change as we
Right,
get
well, the
closer.
program is up and running.
It's the next iteration that allows for a 10-year loan instead of just a
Well, it's
5-year
based-
grant.
right.
So I just wanted, that's the caveat. So what you see here in this white line in the middle where it says total new apartments or beds dedicated, see that 444? That's all the new housing or shelter beds that we're creating that we can then be moving people into or serving people that are homeless. The next one is I think it's the most interesting one on the chart. And that's because you've invested in over years, this yellow or orange one, you've invested in affordable housing, permanently affordable housing for years. When we have turnovers in our apartments, 35% of the time, we use that apartment for somebody coming out of homelessness without to put it in entry. And so without putting an extra dime in, you're now helping 420 folks a year on average, based on my modeling, move out of homelessness just because you've created this resource in your communities. And so I think that's a big bonus for what you've done over the last 7 years.
Just what kind of turnover you have in the rental properties in particular?
It's been different the last few years because of the rental assistance, but it's roughly 100 a month statewide. And
100 a month,
100
all rental types.
in the affordable housing network. And so, about 1,200 a year. And different organizations will have different percentages, that's why I don't wanna say it's this or that. But the Act 81 reporting, I mentioned this before you were here, from B3D, Tabulous, gives you that number, and JFO has that, or I could provide you with that. They have the last 6 months of turnovers, and how many of those people, how many of the apartments were filled with people moving out of motels or out of shelters?
Well, one of the questions and perhaps you've already discussed it since, it's late getting here, whether or not you have any Decker Towers problems.
That's not our property, it's not our property.
I realize, similar, I mean, problems that are similar to.
We have had, yes, we have had people break into our buildings. We've hired a lot of security. We've kicked people out. We've had to clamp down, any kind of drug dealing, we clamp down on right away. We also do a little bit more, in our shop, we do a little bit more community building and engagement. So we have a more positive response to making sure people have a community and people feel like they have, their landlords are on their side. And so we haven't had anything close to that. We're not immune to what's happening in the community, but we deal with it just like this. We can't put up with it.
Yes, I mean, that was again, one of my questions. I look at rental and moving out of homelessness and turnover is, are you able to deal with it quickly?
Yeah.
How do you deal with it? Because, tenants have rights,
Yep.
as well. So, you have a problem like that, and we've all read the article. How do you do it?
Well, we have security guards that walk around and actually remove people. And we also have, if it's connected to a tenant, we need to start the eviction process. If there's drug dealing going on,
How long does that take?
it depends on whether they have back rent that they owe to, and so it's a range, but yeah, there are lots of people that are addicted right now. It's just hard to.
Oh, I just think, as we talk about housing, one of the things that we should be talking about, at least thinking through, is safe housing. Housing in which if you take you put a tenant in, the tenant does not like, at least if what we read about Decker Towers is true, the tenant then becomes at risk and has, what responsibility do we have, and have we funded what needs to be done in order to ensure that we have a safe environment?
So I think adding in additional resident services so that we can respond quickly. We can't, it's hard to call, if there's a mental health crisis, when we call Howard Center, God bless the work that they do, but it's not fast. And the same thing with police these days. And so we have to, and I'm not casting aspersions on any other systems except for the situation is bigger than what any one agency can do. So what we've done is we've just invested.
Great, I'm gonna keep moving us along. We have Frank following Chris.
Okay, so, sorry. So what you see here is that when you go out to 28, 29, 30, what I'm hoping is that we get back to a point where maybe even sooner, that homelessness is rare and brief. And that it's just economic issues or maybe domestic violence, unfortunately, that is not that crisis that we have here. Okay, and follow me, okay? Yeah.
Yeah,
All right, this is my favorite page, and I apologize to Senate Finance folks. Oops. So this is when I run the numbers through the model. This is what it costs. And you see,
That's not
it,
finance, that's appropriate.
okay,
well,
We-
I
one
apologize.
has to raise the money, one has to spend.
Right,
So-
no, I don't mean to joke like this, this is serious, and I appreciate it.
But so isn't the budget we have
Yes,
this
and
year.
I get that you have a very difficult, work just with what you have in front of you and, other surprises that have come to you. so-
Okay, that 177.2, can I assume that's in millions?
Yes, this is all in millions. And so what I have on the top is and again, I just want to tell you, this is just a tool I'm providing you. This is, I just want to give you kind of a sense of what we could accomplish. And you see the various programs, as you see some front loading of some spending on these kind of special needs beds and helping people move out of the motel. So we're saving that money, hopefully, or reinvesting that money in a better way. And then at the bottom, are the services that will go along with the housing so that people succeed when we get into the house, because we don't want to have people moving into housing and then falling at the bottom of the leaky bucket. So I'm not saying that this is, we still deal with people. People don't fall into spreadsheets as easily as these numbers do. But this is what I come up with when I put money through the existing system, and then you see at the bottom, somewhere roughly around 200 a year.
200 million a year.
But that includes services.
That includes services.
So that would presumably not, that would prevent the.
Hopefully prevent some of the churn and who know, you know, if
Well,
you
not
said.
just the, but this, it would address the safety problems.
Yes,
And prevent
exactly.
them from happening.
And there's all sorts of health savings that I'm not sure how to calculate. There's all sorts of maybe correction savings.
Yeah.
There's other savings that we would generate. It's just, you need to have a
But
little
this
bit.
is just spending
It's just.
without the benefits, it's just the
Exactly,
expenditures.
exactly. Thank you
Okay.
for pointing that out. So that's what I come up with in terms of my modeling. And then I'll just go quickly to this next page.
Yeah, just point out before you get too much further along. I just did the quick math on the number of units that we would be creating by 35. It's less than 10,000. It's just over 6,500 units.
I think the number I have is, well, yeah, that's just for people that in this moving out of homelessness model. It's actually
Right, so if we
7,500.
add, so if we, yeah, you and I come up with the same number, 650.
Well, those aren't all new. And that, on this chart, I'm sorry, I'm jumping around on the screen here for you, but the existing portfolio takes up a bunch of it.
Yeah. So I think what we also want to do is compare the need that's been identified by Vermont Futures and by VHFA, the 30 to 40,000 units over 10 years. And match that with,
So those
and those
are.
are lots of private units too.
Yeah, that's-
And it's not, it can't be all this, but it would be great to know in this model, what's the total number of new units that's represented here compared to what our need is, knowing that a huge percent is private.
And that's the next step.
Right.
And that's something I can't do without having that information from VHFA. But I hope that does happen. Again, I lack some patience sometimes. So I'm
Really,
trying
you
to.
strike me as such a patient person.
So I just want to go to the
Yeah.
page with the assumptions, and just to give you a sense of what I put into these numbers, you can see those. I'm not an economist. I don't know if we're gonna have 5% inflation. Someone told me it should be 6. I think some of the work that you've done with zoning and
Our work will
permit
have an
reform
impact.
will have an impact on this. I don't know how to model that out. Maybe someone can do that. I know I saw a report in Minneapolis that they have actually kind of slowed the growth of.
Yes, I heard that on
Which
Vermont
is,
Public.
which is great. So if we can
It was
change,
terrific.
if we can tweak these numbers in one way or another, we can get more benefit. Maybe we don't need 10 years, maybe we need 6 or 5 or, what. So I just wanted to, as my, 6th grade math teacher said, it's gonna show you some of the math.
No, that's really important, thank you.
There's a lot of other spreadsheets that kind of go behind this, that kind of use these numbers for. The reason I highlighted a couple of these is these are my best guesses. These are a little less expert. So the medical respite and then the percentage of EHIC. So I'll stop talking because I've been talking,
No.
but I just wanted to share with you my thinking and try to move forward with some more longer term thinking instead of every 6 months we have a crisis and how do we, like, how many people are gonna be unsheltered? So we need to think longer term for the housing needs for.
Well, I think we need to think prevention because we can't afford this. I mean, we can't, it's gonna just eat our shorts. And so we clearly need to spend an equal amount, if not more, preventing this with better healthcare and mental health care for our families and children.
I agree. There's a health crisis and
Well, no, I mean, what's driving people into homelessness? What is preventing, what are the barriers to people earning more so that they can afford better housing for themselves, so they aren't.
Go behind.
Well, that's okay. So anyway, I think
There's a lot of them, but this is really helpful.
this is super helpful, Chris. I think your work here is terrific. Any other questions for Chris? This is,
I know there's a lot of questions,
Yeah.
but
yeah,
I'll
Yeah,
follow
Lucas
up.
Rose.
well,
The one that leaps out at me is $475,000 as a cost per revenue practice.
yeah,
Leaps off the
Yeah.
page at me.
Yeah,
Yeah.
And that's,
And I sort of asked myself is, would any private developer spend $475,000 for rental apartment of this type?
so, what I'll say in response to that is that in Burlington, we have, 130 people on a waiting list for an 8 foot by 8 foot pod right now.
you have how many people?
130 people on a waiting list for 8 by 8 foot pod. Half mile south of that, there are apartments, 2 bedroom apartments going for $4,500 a month.
What?
And I have
Say that again, please.
a half mile south of the pods is a 2 bedroom apartment going for, $4,500 a month.
That's like New York.
And then, a half
You
mile,
just wait till the property.
half mile north of it,
20%, and it goes into that rent.
but a half mile north of that is a $1.5 million condo, which is a 2 bedroom condo. So, I think-
It's obviously supply and demand.
Yeah. exactly, so I think,
You
I
have the
think
supply,
builders
the
are,
price would not be that high.
Yeah.
But presumably on the one hand, but on the other hand, you're the one who's building the stuff, you know? I look at 475 and
how do you find someone to
and I
buy
said, well,
or rent it?
I said, first of all, I say, why?
Right,
You know, what are the components that drive a cost that high to build a 2 bedroom rental apartment in Burlington?
anywhere.
That's
Anyway.
on
I
the
mean,
street.
That's,
And I mean, it's the same thing that I look, when we look at properties at Bellas Falls and
right,
so on, where
that's.
I was looking at the same kind of
Yeah.
numbers, you know. In effect, rehabbing an old garage in Bellas Falls, Vermont, how would you spend $475,000?
You're actually demolishing, and that is, they
Yeah.
demolished and built it again from the ground up, and yes, there's a private project that
Yeah.
is more than that per unit. That I can talk to you about.
Subsidized.
It received public funding, but it's still a private project.
Well, the reason I ask is, would any private developer who is producing a private, producing a home for a private market spend that?
Well, then,
Not with the rents that these people, do. They would have obviously a higher rent,
Higher
and that
rents.
would be in the
Yep.
3,000, 4,000 per
Yeah.
unit.
yeah, if they can get the rent,
If they can get.
if they could get
and
the
that,
rent.
that's.
Well, they are, because now they're building that. I mean, in Burlington, they are building
Burlington,
private building, private, owners or,
Private
developers are
developers.
building housing, and it's going to cost a lot to buy it or to rent it.
So
Can I just add a couple things?
Yes, Kate.
Sorry, I know we
Yeah.
are behind, so I I just wanted to say a couple things. And Chris, I've already had some back and forth with him, but I want to see the housing community be more proactive in helping us answer the question, will Act 250 reform bring these costs down? You have a lot of that information. It's just per project. And one of the hardest things to measure is the reduction in density of a project. Reducing density of a project increases the cost per unit. And all over the place, when we see a project go through local or state permitting processes, the first thing that happens is the density of the project gets cut in half, even if there's agreement that it's appropriate land use for housing. So, what frustrates me is that the housing community should be on the forefront of being able to tell us these costs. And I don't know why it's a footnote. That's my first comment. And then secondly, Chris knows I believe Champlain Housing Trust does an excellent job with closing the homeownership gap for low-income people and people of color. I myself went through their first-time homebuyer program before buying my first house. But we need to be able to know how to replicate that. And nobody seems to be taking responsibility, not for the actions, which I think you're doing quite well, but for the policy that will help us close these homeownership gaps in the future.
Thank you for that. I will say that in the next month, the homeownership program that we have that has been providing down payment assistance to BIPOC households will be extended statewide through the shared equity programs primarily. But I hear you that there needs to be policy, and it needs to be beyond just shared equity programs. So we are all in on this.
Thanks, Keisha. Yeah, I mean, you alluded to and Wendy asked also about the impact of all our updates, both to Act 250 and the zoning bylaws. All that work will have an impact, and we hope will speed things up, but also reduce the cost considerably. And I wonder if I would hope that we could track that actually as it gets implemented.
So that really is gonna be my next question.
Yeah.
Do we have formal methodology to know, to help us understand whether or not what we did worked
Yes,
and whether or not it's producing results and how it's a measurement issue?
I think that's a
It's
question
critical.
both for Frank and for Chris. So Frank, given our time, why don't I ask you to come up and join Chris, because it's a conversation.
Oh, you want me
people.
to stay?
Yeah, sure.
That's on my screen.
And why don't you pull up a chair, because you're both doing this together in large measure.
Absolutely.
It's a 1950s two-bedroom ranch.
And I think, Frank, do you have a PowerPoint for us?
I was
No.
just gonna, I sent,
So
everyone.
let's
yeah.
welcome Frank to the table. As you all may remember, Frank is our new executive director of the newly formed Housing and Homelessness Alliance of Vermont, which brings together so many of our housing partners. And Frank, you're now in month 2 or 3.
Started December 18th.
Oh.
Yeah, almost over 2 months, yeah.
Yeah. Anyway, you're still smiling.
Yes,
This is good.
yes.
And so we'd love to have you weigh in on this conversation. And I think both of you, we would hope we could figure out how we track these changes, because you're right, I mean, well, we're all right. We need to figure out the impact of our policy changes and
Okay.
updates on speed and cost and reducing barriers.
Can I make a suggestion?
Yeah.
As the legislature, you can direct state agencies to
Yeah.
give you information. And as state agencies that are our funders, as nonprofits, we provide them with information all the time. And so you can ask them to say, we want you
Yeah.
to work with your nonprofit partners to identify the last 5 years, the last whatever, to do this analysis. And then if you have a baseline for the last 5 years of what permitting or time or like, I don't know, all the metrics you want to use, but it's a finite number of numbers. And then start to track as we go along and put a marker in the sand where this is when you changed the law. And this
Right.
is the impact, and we can do that. There are other variables that are involved, but I don't think I hope it wouldn't be rocket science to do that. I think you just need to tell DHCD or somebody to
Right.
just tell us that we have to respond to it.
Yes, you're
But when-
absolutely right. And
When we have asked for that in the past, because I've asked for longitudinal data on homeless, on tracking people out of homelessness and how they fare, how they do, just like I'd love to do the same thing for corrections. We are poor at following up because it costs money. And it's not that hard, it's expensive. And it takes people and time. And yet we do need to know how we're gonna measure our success.
We have a database of all the interactions that our resident service coordinators have. We had interactions with 850 residents last year, a total of 6,000 interactions with those 850. And we're building that so that we can then identify what are the interventions that work. What are the ones that have been most successful? What are the ones that happen so often that we need something better? And so we're trying to build that into our systems, but it's not.
It's not easy and it's
Well,
not simple. And
yes, but we can be clear and say exactly what we want and then bring it up again and again. That's what we need to do.
Yep.
And I'm gonna be quiet for a second, so Frank.
Yeah.
Okay, well, I had a question, talking about housing. I've heard several shelters, home health people, that they are afraid to go into the rooms, in the motels to deliver necessary home health service because of the guns, other weapons, drugs in full sight. And most of the places have had to develop a separate room for any kind of social work. Are we allowing that in housing? Can people? I'm wondering if we're just switching somebody from a motel room to a bigger room with about maybe a kitchen facility. Are we just recreating the problem, or are we starting out with something?
No, I don't think we're recreating that problem.
Okay.
I mean, it's tricky. You
No,
can't take away,
yeah,
can't take away people's First Amendment rights.
No, you can't.
Or Second Amendment rights, sorry.
I
And,
was visiting today.
but we do engage when we see what we think is illegal behavior, and we just don't accept it. So I don't think a lot of the motel owners are taking the same kind of proactive
I
approach.
don't even.
We have a motel, we do take that proactive approach,
Good.
so.
No, I
but
don't
we
think there's
can
any
look for it,
staff
so perfect.
in my local. My
So,
neighborhood.
yeah.
So
No, no.
we need to pivot to Frank. We have 15 minutes and Frank, welcome again.
Thank you very much. I appreciate the opportunity, and I think a lot of what I would talk about is really building on what Chris already presented to y'all. So I have, this is a copy of the legislative priorities document that we had submitted to y'all at the beginning of this legislative session. But again, Chris has done tremendous work since then to really flesh out some of the numbers. So what we had presented was really about what we wanted to accomplish this year. Chris has been able to model that out for 10 years. And so I don't know if it makes sense to kind of work off this or kind of build on what Chris had talked about, but I think
Should do a combo.
sure.
Frank, maybe I could interrupt to encourage you to more fully introduce yourself and what I think is a new Housing and Homeless Alliance. Things have been combined, and this is kind of a new logo for us, I think. So
Yes, I'm sorry, I thought you'd done it, because you testified before in here, or at least.
Not in this committee.
No.
Not this,
Yes,
okay.
yes.
Then I apologize.
I have no idea.
Oh, I
Okay.
apologize. So yeah,
Introduce yourself and tell us how all of these 8 groups have come together.
definitely. So my name is Frank Knack. I grew up in Manchester, Vermont. I spent basically I'm a TVM, spent my entire career since then doing civil rights work, mostly in the South. My wife grew up here, so we moved back to the three years ago because we wanted our kids to grow up where we grew up and where our families are. So we lived down in southern Vermont. So HHAV is a represents a merger of the Vermont Coalition to End Homelessness and the Vermont Affordable Housing Coalition. Both organizations that I think y'all know have long histories in Vermont. I think one of the pieces around that is those organizations had historically worked very closely together. Obviously, seeing the intersection between the connection between ensuring that we have sufficient number of permanently affordable housing units as an ultimate solution to the homeless crisis, but also that we need to provide services and shelter for those in need in the immediate time. So now that we are combined, we can kind of bring together our 60+ member organizations that include housers, that include shelter providers, that include service providers, to really better understand the universe of needs that we have. And so really fortunate to be able to work with Chris and CHT and all of our other partners on some of this modeling. And I think what we're trying to do is working on that modeling, kind of building out advocacy plans around that to realize that, and also look at shelter needs and some other things that we want to incorporate into that. And so the document that I had submitted to you all really kind of goes through that in 3 buckets. And those 3 buckets are basically what I mentioned earlier. So we need to ensure that we have a pipeline of permanently affordable housing and affordable housing units as the ultimate solution. We also need to recognize that even if we're putting a roof over everyone's head, they may have specific needs that if we don't meet them, they could be health needs, substance use, mental health, transportation, that putting a roof over someone's head is not enough. We need to be able to provide those wraparound services for those who may need them. And then finally, recognize that even if we have a perfect housing system where everyone has access to housing, there could be crises where people lack housing for myriad reasons, the flood last summer, domestic violence, fire, whatever that might be. We need to have some type of permanent shelter system in place for those specific needs down the road. And I think that's the future there. That's where we want to be. But also recognize that's not where we're at today. And so while I think the work that Chris has done shows that the imperative of making large multi-year investments to build out that pipeline of housing, to build out the pipeline of services. What I think is really important that we not forget too is that we have a little over 500 shelter beds in Vermont right now. They're all full. We have over 1,600 people or households right now in the General Assistance Emergency Housing Program. And so we have an acute crisis of homelessness right now in Vermont that we can't forget about. And so I think what we're really concerned about in the immediate future, in addition to building out the pipeline, is that, we are coming up on some very concrete deadlines, where potentially thousands of Vermonters may become unhoused in the near future. So we have the adverse weather ending on March 15th. We have the June cohort ending on April 1st. Combined, that's over 1,600 households. That's 1.6 is the number that I think the state uses. So that's over 2,500 people, including lots of children, lots of seniors, lots of people with disabilities, pregnant people. It's very much an acute crisis. And the other number that we haven't talked as much about, which is in the Senate BAA right now, version of the BAA that passed, is the March 1st deadline of when that rate cap goes into effect. And so on March 1st, what would happen under the current proposed BAA is that there'd be an $80 rate cap on hotels per night.
What's rate cap?
$80 per night.
Oh, I thought it was 75.
It was in the House version 75. The Senate raised it to 80, but after consulting with a number of folks in our network, we understand that the majority of hotels would not provide their rooms at that rate cap. And so we're looking at less than 2 weeks from now, having potentially 1,000 plus people without access to housing during the winter. So obviously still in adverse weather, and understanding too that when we don't provide those needs, we have other things that happen. We have a criminal legal system that unfortunately, will pick people up. We have emergency rooms that are already overflowing that will have to pick those up. The costs of those are staggering compared to the hotel costs. It's like $260 a night. For a corrections space, it is, I think, $1,200 or $1,300 on average for an ER bed per day versus $132 or $131 a day for a hotel. And so we are really concerned that immediate future that we address that need, and then as we build out a longer term shelter plan. And so I think one of the really great benefits of Chris's plan is that we're building up the level of capacity that we need to ensure housing. And at the same time, if we do that, we'll be able to build down the need for shelter space. So we'll never be rid of the need for shelter space because as I mentioned, emergencies will happen. But this massive need of, the 1,600 GA program plus the 500 shelters would not necessarily exist anymore. And so that'll be a high upfront cost that'll go down over the years as we invest in the program that Chris outlined. So I know that's kind of in a nutshell what we presented. And I also think when you were talking about other ways that we can mitigate the costs, I think there's also other evidence-based programs and solutions that we can be thinking through that would also help offset some of these costs, which are like, we continue to treat drug use as a criminal offense. We continue to stigmatize people who use drugs. And so if we move from a kind of criminal legal response to drug use to a harm reduction, evidence-based approach to drug use, that also is not only in terms of saving lives, hugely impactful, but also less expensive for the state. And so there's going to be legislation coming over, it may have already come over to your body, that's passed the House around overdose prevention centers. And so those are evidence-based harm reduction programs that are in over 14 countries right now. the universal positive outcomes. You've seen huge reductions in overdoses, reductions in dirty syringes. So obviously the needle pricks, things like that, the associated cost of bloodborne disease outbreaks is reduced. You haven't seen upticks in crime. You see actually people are more likely to go into treatment when they use an OPC versus not, because they build relationships and trust. And so you actually are getting better outcomes. And so if the goal is really to kind of save lives and reduce harm, we can invest in these evidence-based programs to help us move in that direction. So I think it's the totality of all these things that we need to be thinking through, not one single reform is gonna, and then I think one of the great things is the bill you all passed on the Be Home bill, that tackled so many of the issues that we think are important. Funding for BHCB, rental arrears, all this, but also, the impact of short-term rentals and having to regulate short-term rentals. I mean, that is a lot of units that are offline right now in Vermont. And so I think, really appreciate the response and the approach you all took, recognizing that this is not a, regulatory only fix, or it's not a unit only fix. It is a holistic problem, it is a problem created by multiple factors. And to address this, we need to address all those multiple factors going down the road. And so look forward to supporting the Be Home bill as it moves over to the other committees in the House.
Can I just say, first of
Yeah.
all, Frank, it's nice to meet you. I'm sorry I couldn't be there in person. We really are grateful for you supporting the Be Home bill as it moves through the legislature. I do think that one of the benefits of having a larger alliance of a lot of housing providers, as I said to Chris, even though he's just the messenger and he's not in charge of an alliance, is that you all can coalesce around a bigger agenda and find consensus. And it would be really helpful, I think, for you talked about evidence-based, solutions, and we are seeing all over the country the evidence pointing to healthier vacancy rates as the best way to achieve lower homelessness and lower rent increases. And we're not going to get those additional units if regulatory policies keep reducing the density and the availability of housing. So in the future, I would hope that you all can add regulatory reform and tracking what regulations and local and zoning are doing to the housing market and units available. And, we need the organizations to start speaking the same language that the money committees speak as well, because a lot of this one-time funding or things that don't have an existing revenue source will be taking away from other things in the budget, ultimately, unless we find new revenue sources. So, to the extent that your organization can be working on regulatory reform to bring down the costs and agreeing on appropriate revenue sources to fund these things, that makes our job, a little bit easier to help actually change our paradigm with housing development.
Yeah, no, I definitely agree. And I do know we've been talking internally on the regulatory side, and I think are very much recognizing that is one piece of the puzzle that needs to be addressed. And also, and kind of, connected with regulatory is the appeals process and making sure that we have shorter appeals, like 6-month cap on the appeals process, and whether that is through the kind of environmental, more administrative regulatory body versus the judiciary. I don't think we're, that's not our fight, but we recognize the need to shorten that process and have realistic timelines for resolution of appeals. And I think, again, completely also agree on the need to raise revenue and to identify new revenue streams. I think, as I mentioned, these are all interconnected issues, drug policy. I think what we're trying to do is kind of reimagine what it means to build safe and equitable and just communities, and recognizing that, true role of government is to ensure safe and equitable communities for all. Then the basic need of government is to provide basic needs of people in their communities. And so that's not only housing, but it's also issues around safe environment, transportation, quality public education, food security, all of those issues intersect with both safe and just communities, and that costs money. And so we recognize the importance of building revenue streams to be able to fund adequately those programs.
Okay. My concern is that affordable people that live in subsidized housing are not usually high-income taxpayers. To build these safe, just, equitable communities, we need somebody to pay the bill. And I think I'm concerned if we just concentrate on low-income housing and we do nothing about the middle, we're going to turn Vermont into a theme park where rich people can afford to live and will take care of poor people. But the middle class, who are your base taxpayers, and traditionally the foundation of your safe, equitable communities, are not there. And I was just showing a picture, the house on my street. Now, yes, that, it was a 2-bedroom ranch built in the 50s. They couldn't get permission to put a bedroom on the end, so they stuck this big box over the garage. It's $475,000. That was a starter home on my street. It's supply and demand. There's no supply, and I think somebody probably will buy that.
Probably by the end of the week,
For cash waiving contingencies.
Yes.
No, it's.
although we're seeing less of that.
Oh, you are, okay. Down where I live, they're still waiving everything.
Oh, yeah, no home inspections.
Yeah.
People across the street bought a house with a wood furnace, no home inspection. I don't know if that wood furnace is working adequately.
Yeah. And I think that's, and Chris could probably get into this more, but the missing middle program that BHFA is running, I think is really trying to tackle
Yeah,
that issue and recognize that we need to have housing.
Can I, so I really appreciate the way that you structured the priorities. And it would be helpful to me at least to have kind of a scorecard column on this saying where we are on, because I think at least in our bill, we did meet some of these.
Yep.
We are proposing some of those
Yeah.
amounts and thresholds, but
Yep.
as all the bills move through and things get complicated, it would just be really great if you could update
We could definitely do that.
and
One of
just.
the things I've provided you, a second file on your website is the spending the last 3 years. And where we're at so far this year with the budget adjustment, the governor's recommendation, and then what was in 311.
Oh, and that's on our
Yeah,
website. that's on-
just on the capital side.
Thank you.
That's
Thank you.
great.
That's
Yeah,
really
that's terrific.
helpful.
We'll incorporate the services and shelter piece
Perfect.
Yeah. for beyond, but also for other legislation moving through. So there's one place to see.
Great. And then just to comment, it's really scary what you said about the hotel owners not being willing to
Yes.
take that. I don't know if they're bluffing, and I did hear that it was an article that had the hotel owners saying that. Hopefully they're bluffing, but that's it's
but
that
what
scary.
are they going to do? I mean, the hotel in my neighborhood was iffy before the homeless went in. They'd have to do $1 million in renovation to make that suitable to rent to the general public. And it will take some time to bring, I mean, these don't tend to be prime or any hotels.
Well,
Yeah,
We're in a difficult situation, and
yeah.
I don't know who is leading that effort.
Well, that is my
I think
question.
it's
Who
the
is,
appropriations.
no,
Well,
I don't
or
think
is it
they're
the
negotiating with the
administration?
motel
I mean,
owners.
who
That-
is?
It's AHS.
A conference committee really decided, I mean, that.
Yeah,
Well, they'll decide the amount, but
Yeah.
then someone
Yeah.
must be speaking.
Exactly. Who's
It's
negotiating?
Chris Winters.
Commissioner Winters, I believe
Chris
is
Winters.
Oh,
negotiating, but yeah, we were on a call
Thanks,
yesterday
Rachel.
with some of our,
Right.
oh, sorry.
no, Keisha added that.
Okay, yes, we were on a call yesterday with some of our shelter providers, and it is like complete panic right now. I mean, this is literally less than 2 weeks away. They're being told by people who are housing their folks in their communities that they're gonna be out of housing in less than 2 weeks. And there's no, I mean, these are folks who already have no capacity, like zero capacity. Again, and that's just in the shelter side. There's also thinking about substance use capacity, mental health capacity, transportation capacity. And if these kids, there's, I think, over 300 kids in the program right now. So if those kids are in schools, how, if they get pushed out, are they out of school? Are they gonna get busted? I mean, the kind of ripple effects of the failure to fix this on March 1 are so enormous, and the fear we're hearing from folks in the community right now is like complete. They have no idea what to do. And they're panicked that the administration doesn't seem to have. Yeah.
So we have to do something about
Yes.
we as a legislature.
And there'll be a landing spot because in many ways they've been way overpaid for these rooms.
Yeah.
So.
Yes.
I have been working with Senator Kitchell on this. People are welcome to share their comments, but I think you've heard me say at some point that I put all of our housing political capital on the appropriate rate and a meaningful date for the motel program. And they are looking at long-term leases. The motel owners are actually asking for long-term leases because this is really difficult for them too. When they're told the program might end this month or this month or this month, they're the ones who have to exit people, and they're not professionals at exiting people or even helping these folks. So I just don't want us to blame any one part of the system here. It's a much bigger problem.
Do you feel that it's going to be resolved in the next 2 weeks?
From my conversations with AHS and our Senate Appropriations Committee, I think they both understood the issues. I think there was some kind of escalator of nightly payments for agreeing to additional services, cleanings, etc. For many of the motel owners, that's all they've wanted is consistency and certainty. So, you know, we can have those folks in potentially this week. I don't know if our schedule's finally filled up, but you know, it's hard because it's no one committee's jurisdiction necessarily. It's more of a health and welfare issue.
Yeah, and I'm sorry, I just need to move us along. We have a whole group of witnesses waiting online and that I have not appreciated. I thought they were coming in, so let's take one last
I was
question.
just gonna say, the bottom line is we are on an austerity budget, a governor's budget, level funds of all the social service agencies. So, there isn't money.
Yeah.
So, okay. No, this is absolutely true. So thank you, Frank. Thank you, Chris. More to follow. That was great. That's very helpful. Super helpful, both.
It's wonderful to meet you all. I really appreciate your time.
And great to have you. I just, having seen you so I just hadn't sort of expected, remembered that you hadn't presented to the committee.
Yeah, I just want to put a plug in to say, yes, I would appreciate having folks in our committee.
Right. On the motel program?
Yes, yes.
Okay, we are going to pivot to a conversation we began earlier this session to discussing the housing for our migrant community and our migrant families. And we have a number of people we're welcoming by Zoom. It's wonderful to have you. And I think Will Lambeck, are you wanting to take the lead orchestrating this conversation? And you want to tee us off and kick us off?
Yeah, good morning, members of the committee. Will Lambeck with Migrant Justice. Thank you so much for having us in front of the committee today.
It is a little awkward. Is that on whose end?
The volume is all the way up in here.
Okay, so our volume is up.
It's got a vibration.
Okay, anyway, keep going. We'll make it work.
Okay, is this any better? Or if not, I can go off my headphones and maybe that will be better.
It might be a little better off your headphones. I hate to say it, but it's very tinny and quiet.
Sure, how's that?
That's better.
Fantastic. Sorry, looks like the problem was on my end. So again, good morning, members of the committee. Will Lambeck with Migrant Justice. Thank you so much for having us back in. So yes, this morning we have some testimony for you all. I'm going to be speaking, and then I'm going to turn it over to Zainab, who is on as well, as the Multicultural Youth Program Director at Spectrum Youth and Family Services. And then following Zainab, you're going to be hearing from 3 members of Migrant Justice who will be providing a testimony in Spanish. and I'll be providing consecutive interpreting. You'll hear from Diego Truco, Yari Hernandez, and Yesenia Hernandez. You also have received written testimony to your committee from another migrant justice member named Luisa, as well as two organizations, the Central Vermont Refugee Action Network and the Chittenden Asylum Seekers Assistance Network. So I hope you have those in front of you as well. Supporting these proposals or these provisions, in addition to migrant justice, are the Vermont Human Rights Commission, the ACLU of Vermont, the Center for Justice Reform at the Vermont Law and Graduate School, Champlain Valley Office of Economic Opportunity, Bridge to Rutland, Community Asylum Seekers Project, as well as the other two groups that I mentioned who had submitted testimony, CASAN, the Chittenden Asylum Seekers, and CVRAN, Central Vermont Refugee Action Network. So I know that the last time we were in front of the committee, we gave a brief walkthrough of what the proposed language is. I'll just go over it quickly again. We are seeking two changes to state law, which would increase housing access for immigrant families. One would be to define immigration status as a protected class in the Vermont Fair Housing and Public Accommodations Act. Currently, discrimination against somebody based on their immigration status is not unlawful under Vermont law. Several states have done similar things to what we are proposing. Most notably, New York State has added citizenship or immigration status to many sectors of their human rights law, and California has added immigration status, citizenship, and primary language in their anti-discrimination provisions. So we would seek to do something similar in Vermont to ensure that people cannot be discriminated against in housing or public accommodations based on their actual or perceived citizenship and immigration status is the language we proposed. The second proposal would create a new section in Title IX, Chapter 137, which would state the following: a landlord shall not request nor require the social security number of any individual or member of a household in order to apply to enter into a rental agreement for a residential dwelling unit. If a landlord requires verification of identity, landlord or landlord's agent must accept originals or copies of any form of government-issued identification. This is something that in different aspects, other states have tackled as well in documents previously provided to the committee. We cite a couple. Many states have approached this from sort of a consumer protection angle. Basically, sharing and transmitting social security numbers is something that should be regulated by the state. It shouldn't be happening willy-nilly. So we cite Rhode Island statute, Alaska, and Guam as well has put into law restrictions on requesting or soliciting social security numbers.
We all have your previous testimony from January 12th in our files, so we can refer to that.
Thank you so much. I appreciate that. So that just in brief is what the proposal would be. Now you're going to be hearing from others about the need for this, why it's important that Vermont take these steps. To begin with that, I'm going to pass it over to Zainab.
Hello, thank you very much for having me today. So I'm Zainab Kuyate from Spectrum Youth and Family Services. I'm here today to testify about the obstacle people without social security are facing in Vermont when it came to rental. So I have been working with an immigrant family over 5 years, and I see and witness cases of where a family or a single person was refused housing because they did not have any social security number. So one of the cases I witnessed was last year. I worked with a family from Niger. So they flee Niger because of political issue. So when they came here, they were sent to me through one of my community members. So the wife was pregnant at that time. They were willing to apply for asylum, but one of the main concerns were to find shelter, housing, where they can live their safety until of the arrival of their new baby. Unfortunately, I tried very hard to help them apply for rental housing. We went to different organizations, private homeowner. All of them was asking about their social security because one of their concerns was that they want to check their credit score and stuff like that. So without their social security, they cannot check their credit score. So because of that, it was all turned down. So for about 6 months, I tried everything I could do to find them a housing, but it didn't work out. So they end up living the state of Vermont, and in fact, they really do not want to leave, but at this point, they couldn't stay on the street, before the arrival of the baby, and then they end up leaving. So the second case I also was involved. It was from a young man from Mexico. He moved here from Mexico through a company with a visa work. Work visa, something like that. So when he came to me, his case was about he was living out to a friend's house, and first of all he was working, and then he was making a lot of money. And he was living in his friend's house. And then the house owner find out that someone was living in his house without, they didn't let him know in advance that this guy was living in the house. So the owner asked the guy's friend that he should leave the house, or both of them should leave his house, because he cannot have someone in his house without telling me. And then because she will need to check his background check and stuff like that, also add him at the rental list. But unfortunately, the guy do not have the social security. And because of that, the friend do not have the choice, and you have to tell him to leave the house. And today, and until now, this guy is living in his car, and he spent the night at Walmart parking lot. So I'm told helping him today to find something, but it's not working out. And the third case I have right now is a Congolese guy who fled Congo because of everything that is happening in Congo. So he was sleeping in the basement, in Congolese church basement located at Essex. So he was the guy worked as a dishwasher. So he was referred to me through a Mercy connection. I have one partner worker there. So the lady sent him to me so I can help him find, apply for housing. So same scenario, same thing again. I tried again, he didn't work out. So I was able to find a roommate for him. Now he's living in that roommate house, but this is only for short time. Because if the landlord find out that, the roommate puts someone in the house without, telling them, that person will be in trouble. So right now I'm still working so he can find something, but without social security, he won't work out. So one thing I've been telling myself is that these people, they are homeless, not because they are lazy or they don't want to work or they don't have money. No, it's not the case. All these people, they have money, they are working, but they are not getting a housing because they don't have a social security. So that's the only reason they are homeless today. So I have one question for all of you, if you don't mind. So my question is that how the number is important than human being? Because I feel like they give more importance to the number than a human being, because of this landlord, they can see these people sleeping outside, homeless, they can even tell them that I'm ready to pay 1 year of rent, but the landlord will still say that I cannot do that. This is Vermont law, which is really sad in my eyes. So, so please, if you can answer this question, if human well-being is important, if number is important, then human well-being. And also, I'm gonna ask you to do one thing, and I just want you guys to put your feet in these people's shoes and to understand what they are dealing with, because these people, they did not flee their country because they don't like their hometown. No, most of them, they flee their country because of a security reason and other reasons. So moving here and then dealing with this type of problem is really sad. So I'm begging you guys to put your feet in their shoes and then to understand what they are going through. And then through there, you guys need to think and then make the right decision. So that's what I have for you. Thank you.
Thank you so much, Xenia. Thank you also, your testimony, I think you sent in written testimony, which is terrific. Thank you very much. And it is hard for all of us from so much, who have been so lucky in life. It's very hard to walk in someone's shoes who has fled their country for a host of different fairly violent and unhappy reasons. It's, I'm actually thinking that Haitian, one of the field trips we may want to take is to go and meet with some asylum seekers and refugees and really listen and hear their stories.
I think that's a great suggestion. Absolutely. Immigration is key to our humanity and our economic development. So we should really make sure we're hearing all of those things.
And the founding of our country. We're all, every one of us come here as immigrants at different times. So it's critically important that we get this, that we solve this problem that we seem to have created. And so thank you, Xenia. It's hard to hear about all these people who are coming and working as hard as they can and just having housing discrimination in large measure because they don't have the materials they need for landlords to accept them. Any questions for Xenia before her testimony is written and on our website, I believe. And Xenia, we look forward to further conversation, but I think at this moment we're going to say thank you, and we're going to turn. I think we're going to turn to Diego. Is that right? Thank you, Xenia.
Thank you.
Thank you, Zainab. Great to see you. Thank you, Senator Clarkson. I'm talking with Diego, who is telling me that he is being asked for a password to enter using the link that was provided. I don't know if Magali is in the room. Is there an additional password?
I can try sending one. I don't believe I have the passcode setting on, but I will send one to you.
Okay, thank you. And then in the meantime, perhaps let's go on to the next testimony, who is Yari. Hola, Yari. ¿Nos escuchas?
Buenos días, Yari.
Estás en silencio. Si quitas el...
Ya.
Ok, sí, pues cuando te sientes lista, dale y si me das algunas pausas para estar interpretando.
Ok, está bien. Hola, buenos días. Mi nombre es Yari Hernández. Tengo 21 años y trabajo en un restaurante en Williston, Vermont.
Hello, good morning. My name is Yari. I'm 21 years old and I work in a restaurant in Williston, Vermont.
Ok, tengo casi 5 años viviendo en este estado. 4 años trabajé en una granja de producción de leche y decidí salirme hace algunos meses para hacer un trabajo diferente.
I've been living and working in the state of Vermont for the past 5 years. I was working for 4 years on a dairy farm, and a few months ago, I decided to leave the farm and try something new.
Okay. Cuando Estaba a punto de salirme de la granja. Comencé a buscar ayuda con algunas personas cercanas para que me ayudaran a conseguir un lugar para rentar.
And when I was thinking about leaving the farm, I reached out to a couple friends to see if anybody could help me find a place to rent.
Ya que yo sabía que aquí en el estado de Vermont hay veces que no puedes conseguir un lugar de renta porque tienes que presentar el número de seguro social.
Because I had heard from others that here in Vermont, it can be difficult to find a place to live because you have to provide a social security number.
Okay. Por eso, en lo personal, yo no me animé a hacerlo por mi cuenta propia.
And that's why personally, I didn't think that I would be able to do it by myself.
Porque yo ya sabía que existe este tipo de discriminación hacia la comunidad.
Because I know that our community faces discrimination in that way.
Por eso decidí buscar ayuda con conocidos y finalmente pude encontrar un lugar por solo 3 meses con una amiga de un conocido.
And that's why I had to rely on the kindness of others. And I was able to find a temporary place for 3 months through an acquaintance of a friend.
Me mudé y casi pasaban los 3 meses. Ya era tiempo de tener que salirme del lugar. Y bueno, en lo personal yo me sentía un poco desesperada y pensaba que era algo injusto porque tendría que volver a buscar con tiempo un lugar nuevo.
So I was there 3 months and was coming up to the end of the time that I was able to stay at that place short term. And so I was feeling really nervous and frustrated because I wasn't able to find a long-term place to live.
Yo pienso que es algo injusto el no tener un techo seguro, a pesar de todo lo que trabajamos diario en este estado.
And I think that it's unjust that we can't find housing despite how hard we work in this state.
Incluso en ese tiempo yo pensé, perdón, pensé en volver a trabajar en los ranchos y dejar lo que tenía pensado de hacer algo diferente y nuevo.
And during that time, I thought maybe I'll just have to go back to the farm where I was working previously, and that the idea of trying something new in my life wouldn't be possible.
Cuando tienes suerte y logras encontrar un lugar, vives con el temor de que por no tener el número de seguro social en algún momento te puedan pedir que salgas de la vivienda.
Because even if in the best situation, if you get lucky and find a place to live, you're still living with the fear hanging over your head that they could ask for a social security number and then force you to leave your house.
Okay. Finalmente pude encontrar otro lugar nuevo por solo 5 meses.
Finally, I was able to find a new place to live, but just for 5 months.
Pero ahora me vuelvo a encontrar en esa misma situación de que casi se vence el plazo que debo estar aquí y pues tener que volver a depender de alguien para que me ayude a buscar un lugar nuevo.
And so now once again, I find myself in the situation where my time is almost up, the short-term place I'm at, and I'm going to have to move again and rely on the good luck or the kindness of others to find something new.
Ya que si lo hago por cuenta propia, va a ser muy difícil que puedan rentarme un lugar a mí por no tener el número social.
Because I know that by myself, if I'm renting or if I'm attempting to rent, I won't be able to find a place all by myself because of the issue with the social security number.
Siento que es
Could we just, I'd love to ask Yari, is the restaurant owner or the people who work at the restaurant helping take on this challenge for you and with you? are they helping? I mean, do they help provide housing at all? Or how is the restaurant engaging in this challenge?
Una pregunta, Yari. ¿Los dueños del restaurante o las demás personas que trabajan ahí te están asesorando al encontrar vivienda o cómo se está relacionando los del restaurante con este reto que tienes de la vivienda?
Cuando me cambié al trabajo donde estoy ahora en un restaurante, ya era el tiempo en el que me tenía que salir del otro lugar donde estaba. Y cuando llegué a ese nuevo lugar, como pregunté a los nuevos compañeros y al manager de ahí.
So when I started working at the restaurant, the 3 months at the first place I was at was just about up, and so I asked the boss there, my employer there, about the issue of housing.
Él me pregunté con el manager y él dijo que conocía a una señora que ayudaba como a rentar apartamentos, pero solamente como en el plazo del invierno.
And the manager there told me that he knows somebody who rents apartments, but just over the winter.
Y él me ayudó a encontrar un lugar en el que estoy ahorita.
He helped me to get to the place where I'm at now.
Pero el plazo se vence en abril. Solo fue por 5 meses.
It's going to be up in April. It was just for 5 months.
Thanks, I'm sorry, I was curious how much help her workplace was providing.
Muchas gracias y perdone la interrupción. Nada más quería saber en cuánto te estaba apoyando el lugar de trabajo. Pero puedes seguir.
Sí. Yo siento que todo esto puede cambiar si esta ley pasa. Creo que daría más seguridad a nosotros y a nuestras familias, a nuestros niños. Tendrían más seguridad y más comodidad en algún lugar.
And so I think this situation would change were this law to be passed. I think that we could live more comfortably with more freedom and independence, and we would have a stronger community.
Sí, ya no seríamos tan discriminados y pues no tendríamos que conformarnos con los abusos o algunos malos tratos que hay en algunos trabajos.
We wouldn't face the same discrimination, and we wouldn't have to withstand the same abuses or mistreatment at jobs just in order to stay for the housing that's provided.
Right.
Para terminar, lo siento, iba a hablar.
Dale.
Para terminar, yo siento que tiene la oportunidad de hacer algo positivo para todos, algo que transformaría la vida de muchas personas, tanto de nosotros y de la comunidad, de nuestros niños, de nuestras familias.
And so to finish my testimony, I'd just like to say that I believe that you have the opportunity to make a really positive change for me, for my community, for our families and children.
Great. Yari, thank you. Thank you so much.
Lo último que quería de todavía hay algo.
Oh, sorry, just one more thing.
Sí, que no dejemos que el número de seguro social sea algo que no nos deje vivir una vida digna aquí en el estado de Vermont.
And please, let's not let just the Social Security number be something that prevents us from living a dignified life in the state of Vermont.
Right.
Eso es todo y gracias.
That's all. Thank you.
Muchas gracias. Thank you so much.
Thank you.
And we hear you, and this is very helpful to have. Thank you for sharing with us. We really appreciate. Do we have Diego? Is Diego on the line? Or are we going to get to Yasinia?
So Diego he's trying to call in. He wasn't able to download the app. Magali, are you able to see if you have a caller in the waiting room?
I don't see anyone in the waiting room. I did email you the more extended Zoom invite. I'm not sure if that would be helpful.
Yeah.
So, Yesenia, should we pivot to Yesenia because we just sadly have 13 minutes.
Yes, please. Yeah, let's go to Yesenia, and I'm gonna text the passcode to Diego right now, and that should do the trick. Thank you very much, Magali. Y dale, Yesenia. Tenemos 13 minutos entre tú y Diego, entonces cuando te sientes lista, dale.
What is this, Yesenia?
Buenos días.
Good morning.
Mi nombre es Yesenia Hernández y soy una trabajadora de una granja lechera aquí en el estado de Vermont.
My name is Yesenia Hernandez, and I'm a dairy farm worker in the state of Vermont.
Welcome.
Bienvenida. Puede seguir.
Llevo 10 años trabajando en granjas y quiero empezar con el tema de la vivienda de Vermont. Para nosotros,
Dale.
para nosotros es un reto y para nuestra comunidad porque hasta ahora se están enfrentando esas barreras sobre el tema de la vivienda.
I've been working on farms in Vermont for the last 10 years, and I want to talk to you today about the issue of housing, which is a great barrier and a difficulty faced by our community.
Para mí es una preocupación la vivienda. Tenemos muchos abusos en algunas granjas lecheras y creo que no es justo de que podamos salir de un trabajo de las granjas para ir a tener otra oportunidad en un lugar donde nos podamos sentir cómodos y el no poder rentar una vivienda o una casa o un apartamento.
There are many abuses that we face as farm workers, and it's not fair that we have to stay where we are and withstand those abuses or face those abuses just because we don't have an alternative place to go and live because of the barriers that exist to finding housing.
Sí, y es muy preocupante ese problema que estamos teniendo para mí, porque tengo hijos y no quisiera verlos en ese problema de ser discriminados, de no ser apoyados por no tener el seguro social.
And I have children, and so this is particularly a worry for me because I don't want my children to have to live in a place where they could be mistreated, where there aren't good living conditions, just because that I'm not able to find a better place to live because of a lack of Social Security number. ¿Algo más, Yesenia?
Sí. Y sí, todo esto es preocupante porque sabemos que en otros lugares hay otras oportunidades de salario y a veces estamos obligados como a estar en el mismo trabajo por no pasar esa parte del problema en el que está pasando la comunidad en Vermont.
Because there are other jobs that could be open to us with higher salaries or better wages, but because of the lack of housing, we're forced to stay in jobs that provide housing, even if those conditions are not adequate.
Quisiera sentirme con la libertad de ir y poder rentar un apartamento o una vivienda. Si ellos apoyan esa propuesta de ley, cambiaría muchas cosas para la comunidad aquí en Vermont.
I'd like to have the freedom to be able to find a place to live that's better for me and my family. And I think if you take this step, you'll be granting that freedom to many families in the state.
Just gracias.
Gracias, Yesenia.
Anybody have questions for Yesenia?
Just thank you for sharing your story.
Yeah,
Justice.
yes. And how old are your kids?
¿Cuántos años tienen sus hijos?
Mi hijo tiene 13 y mi hija tiene 16.
My son is 13 and my daughter is 16 years old.
So they came with you. They weren't born here in the States.
Así que no nacieron aquí en los Estados Unidos, sino pues llegaron contigo luego.
Sí.
That's right.
Yeah. Great. Thank you so much, Yesenia.
Thank you.
Right.
Gracias,
And do we
Yesenia.
have Diego? Is Diego able to join us in our last few minutes?
It looks like he is not on yet. I did send him the passcode that Magali sent, but if he's not on yet, I think.
Are you able, Will, to send us some written testimony from Diego?
Absolutely, yeah. We can do our best to provide that.
That would be great. Thank you all so much. And it's moving and challenging, and I think it would be very interesting for us to maybe consider doing a field trip. So we'll maybe figure that out. Keisha, do you have a final question?
It's not a question. I would just want to share in my appreciation. I know it's not easy to raise these issues, and it's valuable to hear people's personal testimony. I want to underscore my intention in putting this housing issue back on the table, that we might consider moving this separately. I know that, some felt it just was too much for our bigger consensus housing bill. I know Senator Clarkson is going to, and I don't know if is that Representative Krasnow in the room?
Yes.
Emily
has joined.
That's great, because I think there's, I'm wondering if there's an easier vehicle to move this before crossover in the House General and Housing Committee.
My note to Tom Stevens,
Great.
my note was, what are you doing about migrant housing?
Right. So I want us to sort out, how we put this on the table, in which vehicle we use. So I'm not going to ask everyone to comment if they don't want to right now, but to sit with this further testimony and for us to look to advance it as its own bill. I think as a committee, nobody really looks at immigration fully in the legislature. And as I said, it's just such an important unspoken area of policy for states. And we are all talking about our workforce. These are people who are here in our workforce, trying to do the best they can and trying to stay safe and housed at the same time. So I just want to make sure we give this its own discussion, and somebody moves it before crossover.
Right. I appreciate that. We have, of course, taken action on driver's licenses in the past and in other productive ways that have enabled our migrant community to function productively in our world. And
also to protect them from exploitation.
Absolutely.
Locked up on the farm.
Yeah.
Before I vote, right now, this all sounds fine. I would like to hear from the Landlords Association. Asking for Social Security number is rare.
I've
never been asked for one. So I want to know, why are they asking?
Yeah.
Because is ICE threatening to come down on them like they threaten to come down on employers if you don't establish citizenship for your workers?
I think that's a great idea to ask them. Angela,
I have certainly seen Social Security numbers asked for rentals elsewhere.
You have seen it?
Yeah, I've seen it because it's typically a useful device to do a credit check. With insurance.
That's the only way you can do a credit check.
Well, it's the only way you can reliably do a credit check.
So that goes again to our credit check work that we're beginning in our
It
housing.
also goes though to the issue of, for those persons who testified here today who were employed, did you not have to provide a social security number on a Form I-9 in order to get the job in the first place? And if so, where did the number come from?
Well, is that something you can answer or they can answer?
Yeah, thank you for the question. So with regards to the issue of credit check, it would be interesting to hear from the Landlords Association or some representative about that. Our understanding and the information that we've provided to the committee is that credit checks can be performed with information other than a social security number, and we provided a couple links to resources that can do that with other information. And so if a landlord feels the need to perform a credit check, a social security number isn't required for that. And that's why the law says, encourages accepting other forms of identification, because we understand that a landlord, may want to verify the person's identification, and that's okay. But they should allow for something other than a social security number. In terms of the employment question, immigration law is very complex, and each person's situation is unique and distinct. And I would just say that this is a housing bill, not an employment bill. I don't know the circumstances of each individual who's living in the state without a social security number. Of course, when we're talking about families, there are many children who aren't working, but need housing all the same. And so as you've heard from several people today, and I think Zainab put it very eloquently, this is about human beings and the need for housing, and that is worth more than a number.
This started out with farm worker housing.
Yes.
And migrants have been here for a long time, and we've done a lot to protect them because they can't get whatever visa they need. Because apple picking is seasonal, so you can get a 3-month one. You can't get a year-round one, but cows need to be held 365. And Americans won't vote, won't work for, mucking cow stalls for
Right.
what immigrants work.
Right.
And we've been working on housing on the farm and making that, but now when people are moving off the farm, there seems to be a problem with housing, but there's a problem with affordable housing across the board. So I'd like to know why they get a social security number. And I'd like to know, do we allow them in Burlington City housing? In Champlain Valley?
Right.
Are they
Champlain
allowed
Housing
into our,
Trust. That's a good question.
subsidized housing? Because that would be helpful.
That would be, and we're gonna have to leave it there. So we'll
Yes.
leave those questions there. We have things that sadly, meetings we have to get to. Thank you so much.
People with guns that want to print them in their.
Muchas gracias. And we're really so grateful for you being willing to share your testimony. Thank you.